She's strangely normal. I get to play interviewer today.
I have April. She's strangely normal. What we want to do, she's going to basically interview me. I have my surgery tomorrow, so I'm super excited and nervous.
They're gonna cut you.
Yeah, they're gonna cut me. They're gonna cut me. No, but she's going to ask just a few questions, some stuff that we feel that some of you may want to know. Just, you know, to cover the basics and all that. Now, I haven't seen these questions yet, so if she asks me something crazy, who knows? But we can go ahead and get started.
Me. Okay, so the first thing is, for somebody that hasn't been paying attention or hasn't been caught up with your video logs, what surgery are you actually having in the morning?
Tomorrow morning I am going to have the vertical sleeve gastrectomy, also known as BSG.
And what does that consist of? Is that one of the newer weight loss surgeries?
It's newer. It's in terms of weight loss surgery. It's still been practiced for quite a few years here. Basically, you know what they're going to do? They're going to stick a tube down my throat, cut along the tube, take out my stomach. There we go.
And about how much stomach are you going to have removed?
They remove about 80% of the stomach.
Okay. And where are you having your surgery?
My surgery will be at Summit Medical Center with Weight-wise. My surgeon is Dr. Walton, and it's in Edmond, Oklahoma.
Awesome, blossom. Okay, so what time are you supposed to be there?
I'm checking in at 8:45 in the morning.
Okay, and for people that aren't familiar, what was your highest weight?
My highest weight, the highest weight that I've seen on the scale is 378. I'm pretty sure that I was higher than that because, I dieted for a few months before actually starting the process. And I'm pretty sure, just by the feel of my clothes, I'm pretty sure that I was heavier than that at some point. But yeah.
Okay, and what about current weight?
My current weight, as of the last time that I weighed in, I was 334, and that was a few weeks ago. So I'm pretty sure that I don't know if I'm the same, if I've lost a little. I won't know until in the morning.
Okay, and then I know a lot of different nutritionists, doctors, they want to set mini goals. And I know you're going to have a goal that's lower than this, but what weight goal are you going to say, hell yeah?
Well, okay, for my first goal, whenever I reach below 300 pounds, I'll be happy. Whenever I hit 100 pounds lost, I will be happy. Whenever I reach, let's see here, 250, which will be shortly after that, hell yeah, I'm going to be happy. And then also, the obvious Wonderland, 199, I will be extremely happy. And when I reach like the ultimate, like 200 pounds lost, crazy amount lost, I will be happy.
Awesome, awesome. Now, I know that there are some medical issues that, with you being overweight, that have affected you. What are some of the problems that you've been having medically?
The main problems that I've had, I've been diagnosed with sleep apnea. There will be times when I'm sleeping that I will wake up and I can't breathe. And I can see what's going on around me, and I try to move my body, but I literally can't move. And do you know how frightening that is to wake up?
I would freak out.
Yeah, and you can't breathe, so you're fighting trying to breathe and trying to move your body, trying to move so you can
yeah.
wake. Oh, it's freaky.
It would be very, very scary.
I also have PCOS.
What does that stand for?
That's polycystic ovarian syndrome, which means that basically my hormones are all out of whack.
Is that caused by your weight? Or it could be exacerbated by your weight?
Most likely it is caused by my weight. So that also means that it would be very difficult for me to have kids. Which, you know, I want some kids in the future.
Some Rugrats. You can have mine anytime. Oh, they're older.
Yeah, they're like my age nearly.
I'm so old. Okay.
They're not old.
So we talked about, are there any other medical problems that...
Nothing that I've been diagnosed
Okay,
with.
what about psychologically?
Huh.
Come on.
Do you know?
Dump it.
Oh, there's so many, like, psychological problems that I have. Like, I could go for days. People don't look at you the same when you are overweight. You know, I hang out, like, a lot of my friends are skinny minis. And whenever I'm out with them, I'm the Duff. I don't know if you've read the book Duff. It is a really good book. Duff stands for Designated Ugly Fat Friend. Which
So do you have to be designated the funny one, and everybody else are the skinny? Like for me, being overweight, I'm always the goofier funny one because that is my role. What's your role?
I would say that I'm usually funny. I don't know. I've got a crazy personality. I'm out there.
Well, you know the stigma is if you can be a funny fat person or a skinny bitch. I mean, seriously, that's kind of how it is.
Yeah, I would say that, you know, that's true.
But psychologically, I'm sorry, I got off track.
But anyway,
Duff.
what was I going with Duff?
Designated ugly fat friend.
Yeah.
That's horrible. I don't feel that way about you.
I
You're
don't-
so beautiful.
Well, thank you. But you just feel that whenever you're with people that are, like, really pretty, that people treat you differently because, well, you know, they'll talk to you, they'll try to get in good with the Duff because if they're friends with them, then they can get with your girlfriends, your prettier friends, your female friends. Also, you know, psychologically, there have been things that I haven't been able to do because of my weight. There were a lot of things in high school that I wasn't able to do, grade school, even now. So I would say that, you know, it's definitely affected me mentally.
Okay. And what about sexually?
Sexually. Well, I wouldn't say that I have any sexual restrictions.
There's no crazy positions you would...
Well,
I'm sorry.
I
There's
guess-
some crazy... I'm going to get my freak on whenever... I'm just saying.
I guess there are some newer sexual positions that I would try after losing weight. I'm not gonna lie. I do enjoy sex now. Probably gonna enjoy it a lot more after I lose weight.
Okay, now here's a big one. What's your biggest fear regarding having surgery? Or fears in general regarding surgery?
Okay, well, my biggest fear right now that just hit me this morning, I'm afraid that I will wake up while they're performing the surgery. And not necessarily like wake up where they know that I'm awake, but wake up where I can see what they're doing and I can't react. I can't say, hey, I'm awake, but I feel everything. That's like one of my biggest fears right
Urban
now.
legend too, and it's happened before. So it's kind of creepy, scary. What else?
Some fears. I'm almost afraid that I'll change as a person. I'm afraid that people will see me differently, which, I mean, that's a good thing. I want them to see me differently, but I'm happy with who I am as a person, and I hope that I still remain the same and that people still see me the same.
And then, what is your biggest hope for the outcome of this surgery?
My biggest hope is that I will be healthy and prolong my life. I really hope that any health issues that I have are cleared up. Any future health problems that I could have, I want those gone. I want to be healthy.
And then lastly, talk us through what you're going to check in, and then kind of talk us through what's going to happen, including hospital stay. And we're going to film this tomorrow, so
Yeah.
we're going to film before, we're going to film after, but kind of talk us through and give us a little bit of an insight of what you're expecting tomorrow to kind of go as.
Okay, well tomorrow I'm expecting, I'm going to check in at 8:45, so I don't know, do I bring my packs in with me whenever I go to check in, or wait, are they going to put me in a room before surgery so I can set my stuff up? I don't really know. I probably should have asked these questions, but I didn't. this bag has this in it. This bag has my medical binder. This has the magazines and the laptop. This one has my CPAP machine. This one has my vitamins. Don't take it in unless they say they need it. They shouldn't need it, but it's here just in case. This one has my clothes in it. I know you're going to love carrying a bright pink Victoria's Secret bag, Dad. I picked that one out just for you. And I told him that. And he was like, well, they can shove that bag under your bed during surgery. I don't want to carry that around. Obviously, he was joking. I love my dad to death. So I'm assuming that it'll be that. I don't know how long the waiting period will be before I go in for surgery.
Surgery can take anywhere from 60 minutes to an hour and a half, 2 hours.
Yeah.
1 to 2 hours.
And then they say that, usually after surgery they'll wake you up within 3 hours or whatever, so you can start walking around. So I'm kind of...
Do you spend the night in the hospital?
Yeah, I will stay the night in the hospital. They'll come in every few hours for me to walk around. They'll quit bugging me at night, but if I want to get up and walk around some more, I will, which I probably will. Me walking with my sexy IV pole. I'll have my bathrobe on, some leggings or something, because I don't want my ass hanging out.
Kicking it,
yeah. I'm staying the night. My dad's going to stay with me. And then in the morning, the surgeon will come in, and if everything's good, I should be out by the afternoon, Wednesday afternoon.
Awesome. Okay. So that's the questions that I actually had for you, and definitely want to post this. And if you don't mind, I'd like to post it on mine too.
Okay.
And just let everybody know, hey, it's time. This is happening, and I'm excited. I am so excited. I wish it was me. I'm so envious.
I am extremely excited, and I'm grateful that my time has finally came. I was just talking to my mom in the car on the way over here, and she said, do you remember all those times that you cried to me saying that your surgery was never going to come, that it was never going to be your turn? Well, the time has flown since September when I started this process, and my day is tomorrow. Am I less than 12 hours now? 12 hours? Right. Less than 12 hours away from going in to have surgery. And I don't know, I'm ready for this, so I'm extremely happy. But I think we've talked enough for now. So we'll go ahead and get off of here. Anyways, this is Lindsay's Losing.
And she's strangely normal.